This year has marked a very significant milestone for not only healthcare in southwestern Sydney, but for Australia, as we celebrate the commissioning of the first Brick Hospital here in Liverpool 200 years ago. One of the interesting things that I've learned over the course of the year is the other health services across the country that have claimed to be the second oldest in the country. But I can tell you that Liverpool is indeed the second oldest hospital in Australia. This year we have celebrated a series of events, and I just want to run through some of them. We opened the Liverpool Hospital Museum, and during the course of the year we've held different exhibitions to mark different points in time of the hospital's history. We had a special Anzac Day military display, as well as a special display for International Nurses and Midwives Day. We hosted a world first conference in diabetic foot, and there were over 300 clinicians and researchers from all around the world that were here for this conference. It was also a special anniversary conference for the Swan Trauma Conference. And again, a couple of hundred clinicians from around the world were here for that. We acknowledge the contribution of our nurses over the last 200 years by naming Burnside Drive in honour of Matron Burnside, for whom was matron for 34 years. We opened our new Cancer Wellness Centre. We held a mayoral reception, and the mayor launched a special anniversary book, A Day in the Life of Liverpool Hospital. And we held our very successful community open day. But to also commemorate this special anniversary, we've prepared a celebration video that shows the wonderful work of all the staff and our community over the last 200 years here in Liverpool. So as you watch this video, I ask you to reflect on how far we've come in the past 200 years, and imagine what the next 200 years will bring. Please enjoy the video.
You would step forward and accept this on behalf of the hospital.
Thank you.
So it's obviously a photo showing the early stages and the later stages.
That'll look terrific in the museum. Thank you.
As many of you know, Anthony will soon be leaving us to take on the position as Chief Executive of the St Vincent's Hospital Network. Anthony, I want to thank you on behalf of the board for your years of service to the hospital. I think you've been with the area health service and local health district for about 10 years, and I think 5 years at Liverpool, is that correct? Yep. And I know that those who work at Liverpool attribute its high morale and sort of high standards over the last few years very much to your personal efforts. So thank you very much. And I know there's been some remorse about the fact that you're going, but I think we should be proud as a local health district that an organisation has chosen to steal one of our leaders. But it is a sign of our maturity and our ability to develop and grow leaders. So all the best for the future. So that brings us close to the end of the proceedings. Before we finish, I'd just like to make a few comments, and these comments would fall into the category that Paul Keating would say. Well, he would say that, wouldn't he? I'd like to thank the members of the board for their work during the year. I want to publicly state how collegial, how functional, how positive and how committed the board is. You can't say that about all boards, but you can certainly say it about your board in South West Sydney Local Health District. I'd also like to put on the public record how pleased the board is and how highly the board ranks Amanda Larkin's performance as the Chief Executive. And we have fed that back to her in the appropriate way, that it is important that everybody knows that. And also the members of her executive who work hard, work tirelessly, and are incredibly loyal. Thank you to them. To the staff of our other facilities, the general managers, thank you for your hard work. It can be a lonely, sort of hard, extremely hard-working position to lead a hospital, and we certainly recognise your dedication and thank you for it. Amanda has appropriately thanked the consumers and the members of the community and the volunteers who give up their time. There is absolutely no doubt the local health district wouldn't be what it is if it wasn't for you people. And for the staff of the hospitals, the staff of the local health district, I can only say that every time I have anything to do with the staff or hear any presentations, see them at work, I find it personally inspiring, and I go home thinking that I must do a better job because they're doing such a fantastic, committed job. So thank you very much.